Welcome back. Denver's mayor is issuing a dire warning that the COVID numbers in Denver are increasing at an alarming rate. This could have consequences for businesses as we head into the winter months. R9 health expert Dr. Payal Kohli joins us now for our numbers crunch. Dr. Kohli, good morning. We've been told that we need to keep it under 5% for positivity rates, and it's now 4.89%. Seems pretty close. So what's your take on that?
That's exactly right, Gary. So our single-day positivity rate is about the highest it's ever been at 4.89%. What we're also seeing, however, is an increase in the 7-day moving average of the positivity rate. We're also seeing an increase in the number of emergency department visits for COVID-like symptoms. And similarly, we're seeing an increase in the number of outpatient visits for COVID-like symptoms. So putting all that together, it really suggests that the disease activity has significantly gone up. And of course, as you pointed out, we're dangerously close to that 5% threshold, where health experts start to worry that we may be overwhelming the healthcare resources. But more than the absolute number, Gary, what really has me worried is the trend. So if you look at the trend of the positivity for the last several weeks, it has been sort of steadily going up. And what the positivity trend tells us, it's sort of a crystal ball that predicts the future. So really, increases in positivity that are occurring week after week predict disease outbreaks. And those disease outbreaks then, of course, multiply exponentially to increase the cases. So if I was a fortune teller, I would say the crystal ball is telling me that we're headed into an exponential rise in our cases. And that's why Mayor Hancock issued that warning yesterday.
Yeah, we've seen more than 79,000 cases so far since March. So is this rise that you're talking about, is this the next surge that we've all been kind of waiting for?
You know, it absolutely is. We're really at the highest number of 7-day new cases that we have been since March. Now, of course, the caveat to that is that we're testing a lot more than we were earlier in the pandemic. But if you look at the shapes of these curves, you can see we never really came down all the way to the bottom. So we're still within our first wave, but we've had 3 different peaks or surges. So first early, second around July, and third occurring right now. But when I look at this, Gary, what I think is we're making the same mistakes over and over again. So the cases go up, we dial back what we're doing, the cases go down, we start doing it again, the cases go back up. So we're sort of stuck in this pattern, and it seems like we're doing the same thing again and again. So what we have to keep in mind is that the virus is by definition 2 weeks ahead of us, right? Because it takes us 2 weeks to detect those cases. So when we're in those troughs, when we have our cases come down, it's not the time to loosen up. It's actually the time to continue to buckle down so that we can get ahead of the virus like some of the other countries in Asia have done.
Yeah, so real quickly, what appears to be the drivers of these increased cases? Is it just people being off their guard?
And that's what's interesting this time around. You know, earlier it was more those outdoor gatherings, but this time around what we're seeing is the biggest drivers appears to be small gatherings at home, dinner parties, going to restaurants, some of the things that we had sort of in the summer thought may be safer to do. That's really what appears to be driving many of these outbreaks. So I think we really have to think about that as we head into winter, that, you know, outdoor is relatively safer, small gatherings are relatively safer, but of course they're not foolproof.
Yeah, boy, it is hard, but we got to get through this. Okay, Dr. Kohli, thanks as always. Appreciate it.